Hi, I'm Katie Meyer. I'm your state hosted director for Montana, and I'm here today at the Billings Career Center where I teach in our CNA lab. And so you can kind of see this mannequin here. There's a few different mannequins in here with the hospital beds. We're moving towards a spot where when we come to state conferences, you'll be able to set up in a lab like this at some of the colleges, City College in Billings or different campuses, where you're going to work with patients using the hospital beds for skills like CNA and home health aid. So this one I'm doing today is on home health aid skill 1, which is taking an adult tympanic temperature. And I'm going to stand on this side of my patient. Normally I'd kind of come around to the other side to a better spot, but I want you to be able to kind of see where I'm at with working on his ears. The reason I'm not wearing a mask is I'm actually using a robot to record, and so it kind of makes the camera angles just a little bit more tricky as I do this. But anyways, as I begin this skill, again, you might want to follow along as you're learning these with the rubrics so you know what's expected of you. It's always good practice to verbalize the skills as you're doing them so the judges know that what you're doing. But I'm going to gather my equipment. I'm going to verbalize that I'm getting together my thermometer, which is going to go in their ear, this style, that I have the disposable probe covers. They usually come in a set like this, and they're just these clear plastic things that are going to go over the earpiece. I have a daily record sheet, which Montana HOSA would provide for you with this scenario. They're going to give you a scenario that would tell you to take this patient's temperature and give you something to record that temperature on. And I'm going to gather gloves. So right now I'm going to verbalize using gloves as I do this scenario. We're still in the middle of the pandemic, and gloves are a little bit hard to come by that I hate to waste them. Hopefully by the time we host state leadership conference, that won't be such a thing, and that's one of the items that you would be required to bring. So Montana HOSA would give you that sheet, and we'd give you thermometers, the patient, and that kind of stuff, but you would come with the gloves yourself, but just know that I'm going to verbalize them for now. So I'm gathering my equipment. That's step number 1 on the rubric sheet. And then I'm going to verbalize that I would either wash hands if we have you set up in a room where you can do that, or you can just use your alcohol-based hand sanitizers that we'd have in there for you. And then put on your gloves. So I'm going to verbalize that I'm going to do that with my gloves, and then I put on that hand sanitizer right now. And I'm going to greet my patient. They would have maybe given you a scenario. This is Mr. Smith, and you need to take his temperature. So I'm going to greet myself and introduce myself. I'm Mr. Smith. I'm Katie. I'm your home health aide today. And I'm going to need to kind of use your ear. I'm going to kind of pull on it a little bit and take your temperature. Is that okay? And so explaining to him that I'm going to be pulling on his ear, that something's going to go in his ear, and just explaining that to him. It's always good practice to have consent. And so then as I'm ready, I'm going to put a new probe on the top of my thermometer. So I'm just going to stick it right in that container without touching it. It just goes right in and it'll attach on there automatically. I'm going to turn my thermometer on. And there's just an on button on these. Okay, and then I'm going to pull the top of his ear up and back as I do that so that I can reach in there easily. And as I stick this inside there, I'm going to wait for it to beep. This one has a button that you turn on to start. It beeps, okay? And I can then relax that. I'm going to read the temperature on the screen. This has an eject button, and it'll automatically, I'll just shoot that at you. Shoot that off, but obviously I want to do that into a proper container. I just shot it at you so that you can kind of see that it automatically ejects that. So again, I'm not touching or contaminating that surface. So I'm going to go ahead and eject that into a proper container, a garbage can, and that kind of thing. I'm going to record that temperature on my daily sheet. And then just the other thing is just reminding that I talk to my patient the whole time. So as I'm doing that, I'm going to let him know that I'm pulling on this ear. I used appropriate verbal communication with him. And as I finish that skill, I'm going to remove my gloves using proper procedure of turning those inside out, throw them away, and use hand sanitizer even after I've taken off my gloves. So this is taking an adult temperature for home health aid.